Excellencies, colleagues, distinguished participants, this meeting of the United Nations Group of Friends to Eliminate Hepatitis comes at a decisive moment, and the region of the Americas is pleased to join the discussion to celebrate progress, emphasize the critical need to scale up access to hepatitis services, secure sustainable financing, integrate hepatitis into broader elimination agendas, and fully engage communities in our efforts. The burden of hepatitis in the region of the Americas is considerable, with an estimated 10 million people living with either chronic hepatitis B or C. Yet only 1 in 5 people know their status. As a result, this silent epidemic continues to cause over 60,000 deaths every year in our region. The lesson is clear. Maintaining the status quo will not put us on track to reach the global elimination targets. However, I am pleased to report that after decades of sustained vaccination, the region of the Americas has met the elimination target for the mother-to-child transmission of hepatitis B, achieving a prevalence of less than 0.1% among 5-year-olds. The next step is to validate this success in each country. I'm also encouraged by strong country leadership across Latin America and the Caribbean. For example, Brazil and Mexico are leading the way on hepatitis elimination by integrating hepatitis services into primary health care, expanding access to testing and treatment, and promoting task shifting and capacity building in multidisciplinary teams. Mexico has screened more than 8 million people for hepatitis C in recent years and successfully treated thousands, thanks to a bold, decentralized approach that now includes more than 2,000 health facilities. Guyana is advancing to new phases of its national hepatitis program by decentralizing services and ensuring that care reaches underserved communities. The Pan American Health Organization, or PAHO, is committed to supporting our member states on this path. In the framework of PAHO's elimination agenda, which seeks to eliminate more than 30 communicable diseases and related conditions by 2030, we have developed Best Buys for Elimination, a practical guide of highly effective and evidence-based interventions for disease elimination, including those targeting viral hepatitis. For example, we include screening of all pregnant women for hepatitis B, and we have encouraged countries to incorporate hepatitis B vaccines into routine immunization schedules. The PAHO revolving funds, which is based on pool procurement, continues to be a very powerful tool for expanding access to diagnostics and treatment. 17 countries in our region have procured medicines for hepatitis B and C through the PAHO fund. Eligible countries can now obtain the complete hepatitis C cure package, diagnosis, and treatment for under $100. This creates a clear opportunity to scale up testing and treatment so that no one is left behind. Looking forward, 3 key priorities emerge for us. First, we must expand awareness and community engagement so that people know their status and demand services. We also need to ensure sustainable domestic financing to deliver widespread and equitable access to testing, care, and treatment. And finally, we must fully integrate viral hepatitis into primary health care and other elimination agendas, leveraging synergies with other health programs, including communicable and non-communicable diseases. In closing, we must protect every person's right to know their status and access care through a joint public health approach that is grounded in equity and primary health care. The UN Group of Friends is an essential platform to keep hepatitis high on the global political agenda and to ensure that commitment translates into accelerated action. Colleagues, let us act together with urgency, solidarity, and commitment to make hepatitis elimination a reality for the Americas and indeed worldwide by 2030. Thank you so much for your attention.